The main findings of this research are about the relationship between the wealth and health parameters and the outcome of cancer in Europe. It is very important because in this period of crisis we are worried about the possibility of our patients to have a good outcome. The main discrepancies are about the relationship between the gross product and the outcome of some cancers, chiefly breast cancer. The hypothesis is that less we expend for patients, for screening programs, for treatments, and less is the survival of patients. In Eastern Europe, the incidence is lower, but the mortality is higher. And I think it is related to the quality of care, to the screening, for example, for breast cancer, but also for colorectal cancer, and to the possibility of having a good surgery, good medical treatment, good radiation oncology therapy. So chiefly, Eastern countries have to improve the quality of care. It is very important to decrease the professional levels of doctors, nurses, and other people active in the care and cure of patients. So there is also a larger role for academic activity, for update activity, for scientific participation, for example, in clinical trials. ESMO can have a very important role in increasing the levels of the quality of care in Europe, and also some years ago ESMO started to improve the education for people working in the eastern part of Europe, which is a very important part of our continent. The role is a role of education, a role of update, of increasing participation in clinical trials, and also in the communication of the results of treatments to the public, also in Eastern Europe. Very important role. The situation in the different countries in Europe is very, very different. So it is important that ESMO, which is the continental society, has a relationship with the national societies of medical oncology, clinical oncology, with the professional groups of doctors in the several countries. There is a good activity of ESMO towards the national societies, and this should be more and more improved. Education of the people is a very important topic. So we have to increase the awareness of people about the risk of cancer, about the risk factors, about the participation to screening and to go to the doctors when you have a problem. You need budget and money also to educate people. ESMO can have an important activity also at the European level, so it is very important to have an activity towards the politicians, to inform them about the results of screening, of therapy, the new molecular treatments, the new techniques in surgery, radiotherapy, and so on. So there is an important role not only versus the doctors and nurses, but also when you speak to the politicians in our continent.